Good afternoon, everyone. My name is Tony Lloyd, and I'm the Assistant Director who looks after the payments and reporting team in the Multipurpose Services team in the Thin Markets Branch and Market Workforce Division in the Department of Health, Disability and Ageing. I'm just quickly going to run through the structure of the meeting for everyone. But before I start that, I just wanted to acknowledge the Ngunnawal people as traditional custodians of the land we are meeting on and recognise any other people or families with connections to the lands of the ACT region. I also want to acknowledge and respect their continuing culture and contribution they make to the life of this city and the region. And I'd like to acknowledge and welcome any other Aboriginal and Torres Strait Islander people who are attending today's webinar and the regions in which they live in as well. Okay, so just commencing the meeting, the structure for today's meeting is going to be, I will take you through the user experience where from the point that you receive the email from the MPS through the MPS annual reporting process. So we'll start by looking at that email and then we'll go through the respective documents that are attached to that email one by one. So the order in which I will do this is I'll start with the statement of income and expenditure, followed by the demographics report, which used to be known as the de-identified client report. And then finally, I'm going to work through the annual activity survey as we undertake it using Qualtrics. At the end of each of the respective reports, there'll be a short period in which you can answer questions. You are welcome to ask questions along the way in either the Q&A or the chat. And Karina and Falana, who are members of my team, will happily let me know when it comes to question time what those questions are. You're also welcome at the end of this webinar to email our corporate email address, mpsagecare@health.gov.au. I'm sure someone will put that into the chat if you have any other questions you'd like to ask about the MPS annual reports. So with that, I'm going to share my screen and we'll start with the email that you're going to receive from the MPS. So I'll just share my screen. Hopefully you can all see that. So we'll be sending out an email and that email will probably come out Thursday or Friday this week. It'll be addressed to the email contacts that we have for each of your MPS services. And obviously a copy will also be sent to the Department of Health in your respective state and territories as well. In the case of Norfolk Island, that would be the Department of Infrastructure. The first thing to note about the email is as attachments, it will contain the demographics report. That demographics report will contain information you supplied in last year's de-identified client file and the client deeming process. So we'll have, as accurately as we can to this point in time, have a list of clients who've received both residential and or home care services at that site. It will contain the statement of income and expenditure. That will include the MPS funding that the department provided to you in the 24-25 financial year, and then ask you to complete the rest of the form. There's also a document there, attachment A, which is a comparison between the old and new annual activities reports, which just shows you what the changes are for the new report. And finally, we also have a use guide, just to help you with that process, apart from this webinar. Okay. The other important thing to note is we've changed the reporting dates this financial year. So both the demographics report and the annual activity reports need to be completed by the 31st of August 2025. And the statement of income and expenditure needs to be completed by the 31st of October 2025. This means that if you're completing the statement of income and expenditure after you've submitted your annual activity report, you'll need to send it to our MPS Aged Care at health.gov.au email address. Okay. And otherwise you can attach it to the annual activity report. So you'll get those four documents. The way that you access your the annual activity report is through a link, which I'll go through later. But I'm going to start with the statement of income and expenditure first. So I'll just open that up. Now this contains dummy data for a mythical service. And I'll just go to the one that I've already got open. That appears to be quicker. So you see it's for the financial year. You'll see that we've already included the Commonwealth funding, both what was budgeted originally and what the actual funding is at the end of the financial year. Now that's because at the start of the financial year, we issue you with a letter of notification telling you what the expected budget will be for that year. And then there may be either government decisions or new policies that are brought in, and or you may have changed the number of places that you've been allocated for during the year. So that's why we give you a budget versus the actual funding that you received. And the same is true of the outbreak management support funding that we provide to your organisation. For the other categories, other program funding such as the Commonwealth Home Support Program or the Home Care Package Program, which will soon to be renamed Support at Home on 1 November 2025 with the implementation of the new Aged Care Act. You'll need to put in what your original budgeted funding for that was and what the final actual funding was. Similarly, for MPS client fees, you'll need to indicate what you budgeted the client fees were and what the actual fees were. It's important here to note that you shouldn't be including any accommodation payments that you received. Okay. And the reason for that is we're able to source that data separately through the Aged Care Quality and Safety Commission. So it's row F, isn't it? Yes, so it is listed there. And then any other revenue you might receive from clients, patient fees, miscellaneous revenue, etc. And that gives us a total idea of your revenue. And then for your salaries and on costs and other expenditure, you detail that there along with capital funding. And that enables us to generate an indication of your expenditure compared to revenue and whether you had what we like to call a notional surplus or a notional deficit, because 98% of MPS providers are state owned, which basically means you're not like a private or non-government organisation. Okay. If you do have a variance between the figures you're reporting for 2025 and the previous financial year, 2023-24, and that's greater than 5%. So whether that's a deficit or a greater surplus, we just need to get an understanding of why that occurred. So if you could provide an explanation, that would be very good. And finally, you get your respective approved officer to sign the form with their name, title, and date, and you can send that through. On the right, there's definitions to help you with any of those specific categories of questions around your income and expenditure. So it's pretty straightforward from here. Just I suppose important to note, we have already included formulas which calculate the proportion variances, so you don't need to do that. So really you should just be entering in the details of your budget and actual expenditure in the form, and it will go ahead and calculate it all for you. All right, so at this point, I'm going to stop going through the report and I'll just check to see if we have any questions. Do we include basic daily fee supplement payments? Okay. So when you're asking about the basic daily fee supplement payments, it's important to understand that this also covers the nutrition basic daily fee supplement in your income. And that should be it, I'm pretty sure. Generally, MPS clients are not entitled to receive the hardship allowance because our funding is on basis of bulk funding rather than individual. So that should clear that up, hopefully, for you. Are there any other questions?
There was one other question, Tony. It's disappeared from the chat, but it was, do you require audited statements or is an acquittal sufficient?
So because the statement of income and expenditure is coming out, it's due back in October, our preference is to have information that's been audited. Are there any other Q&As?
Alison Drinkwater has her hand up. Just one moment.
Alison.
I've unmuted Alison, so she should be able to speak.
She's put a question in the Q&A.
Yep.
Had not to complete this before and therefore will need support to gather the information. So this information for the statement of income and expenditure should be. Oh, you're there, Alison. Yes.
Yeah. I've never done this before,
Mm-hmm.
so I'm not sure. Like, would administration here at the hospital have all that information?
They should have.
Right.
Every hospital has a set of accounts that they'll need to record this information, like the total expenditure and salaries.
The financial, I know,
Correct.
I know who I need to, yeah.
They should be able to provide nearly all this information for you.
All right, okay.
All good.
Maybe, we'll see.
Well, look, if you're having a problem, please contact us and we'll see what we can do to help you out.
Thank you.
Not a problem. Okay, if that's Francesca.
Okay, now can you hear me?
Yes, I can hear you.
Great, thanks so much. So I just had a couple of questions on the report just for clarification.
Sure.
Suppose firstly in the revenue section where you've got Commonwealth funding other CHSP, for example.
Yep.
So understanding that this report is completed at the level of the individual MPS.
Correct.
However, some of those Commonwealth programs maybe have budget allocated at the local health district or other service level. I'm just wondering, how do you expect us to reconcile amounts for CHSP, for example, which might be allocated, to an entire district? Is it how that district has apportioned that out to the individual MPS services, or is
That's
there?
Correct. So it's how the in your case, your local health district is apportioned those funds from, say, CHSP to those individual MPS service sites. Now, because as a provider for the local health district, you'll be providing a report for each of the MPS service sites at your local health district. Hopefully that'll cover all of that funding, but it may not. So what we're really aiming to do here is get a total understanding of the revenue that comes in for that MPS service. And I understand it could be difficult where you're getting funding for whole regions to do that, but that's what we're trying to aim for. So even if you were to try and derive an estimate of the amount of money that's used at specific MPS service site from those underfunding sources, that would give us a better idea than not putting anything in.
Okay, all right, no, that's helpful, thank you. And then my other question was in the expenditure section, just in relation to other expenditure, whether there was any guidance around indirect or corporate overheads and their inclusion in these reports.
Again, I mean, the focus of these reports is to cover all the income. So we're talking hospital and the aged care service at the MPS service. We don't at this point go down into that, so that those corporate overheads would come under the other expenditure category.
Yeah.
Yeah.
Okay. All right. No, that's great. Thanks. Those were my two questions. Appreciate it.
All good. All right. I will move. Sorry. Yep.
Sorry, Tony, just very quickly. Vicky Jackson has asked a question about where the correspondence will be submitted. I believe Vicky is in Queensland, so all of the files will be sent to the main email address for Queensland Health, and they will then distribute that, if that helps. And Liz Uncles from Norfolk Island has asked if audited statements are not available by the deadline, would an acquittal be accepted?
So, in answer to your question, Liz, absolutely. It's better for you to send that through to us and say, this is what we have available at this point in time, because we'd rather have something rather than nothing. But please just indicate that in your email so we know the where you're at in terms of your financial processes with that report. Yep. Okay. All right.
Tony, there's one more question from Ashley in the other chat. Hi team, quick question for other Commonwealth funded programs, CHSP and HCP. Can this information not be obtained internally from the Commonwealth? So
the answer is yes, but as indicated by some of the previous people, we don't always get that direct split of funding down to the MPS service level, because sometimes if that funding is provided at a regional level, we're not sure how much it goes to the actual MPS service. So that's why we're trying to confirm that with each MPS service with the service provider. Okay. Oh, good. All right. I'm going to move on to the next report. When my mouse comes back. Yep. So now we're going to have a look at the client demographics file. Okay. So just to let everyone know, this is a file where basically we're aiming to identify all the clients who've come in and received services during the complete 24-25 financial year. Okay. And the purpose of that is to enable us to get a pretty good idea of the characteristics of those clients who've been receiving both residential and home care services, and when they came in and when they left, and their main reasons why they left. Well, at the start of the webinar, I said that we'll be using data from the client deeming process, and we'll be using the data that we had from last year's 2023-24 de-identified client files. That's still not, will still not be complete, because obviously you've had clients that may have joined the MPS service or left the MPS service prior to the deeming process occurring this calendar year. So hence we need to go out and seek all that information to get a full and complete picture. So I'll first start. The spreadsheet that we send out to you, because it's pre-completed, will have instructions for the two types of collection forms. So there'll be instructions for the residential client data, and they basically just give you an idea of the rules that you need to take into account when you're completing the form, and a definition of each of the fields if you're uncertain. Okay, so that's really there to guide you in completing that. The one change that's occurred this year compared to last year is in the department, the team that looks after mental health and dementia came back to us and said that it would be good if we could change the dementia questions so that they meet the definition under the National Health Data Dictionary. So we've changed that into effectively two questions. One is a client diagnosed with dementia, residential clients, and the other is the client, you think the client has a diagnosis of dementia not confirmed, so you suspect that the client has dementia. And that will basically help them to understand the prevalence of dementia in your clients at your sites. So if we go to the actual form itself, you'll see that we've already pre-completed the data, and that data would have included the service ID, which we have stored in our GPMS system, the state, the provider name, the service name, and then those unique client identifiers that you provided earlier. Now, one important thing to note with the client identifier is because we've got it from you in the past, you don't need to update that identifier. Okay, there's no need to change it because that enables us to link that client record across the different reports that they have been included in. We're obviously seeking information on their date of birth. We automatically calculate their age based on their date of birth, so you don't need to worry about that. We need to know their gender, their First Nation status, and the date that they entered the service and the date that they left. If a client's chosen for whatever reason or has passed away, you need to indicate their date of exit and the reason why the client left the service. And then for the type of client, we have a number of categories. So they could be a permanent aged care client. They could be a permanent NDIS participant who's using a bed in the aged care facility. They could be a respite client, or they could be a respite NDIS participant. There's a lot of work that's going on between the department and the National Disability Insurance Agency around how to solve the problem of providing disability services in regional and remote areas. So that's one of the reasons we want to identify those clients, just to help that work. And then in terms of the referral pathway, where the client came into the service, what kind of assessment had the client received when they came into the service? Okay. If you don't know that the client's received an assessment, just leave that field blank. Okay. And then the dementia questions that I mentioned earlier. And then lastly, we have a column where you're able to add additional comments. So where you feel there's contextual information that's important to describe about the client, it's important to put that in there. There's one other important thing about the records. If a client has come in as a respite client during the year, had either one or more respite occasions of service, and then later on came in and joined the service as a permanent client, it's important that we have separate records for each period that they came in and received services. Okay, so that not only helps us understand the sort of pathway that someone might come into the MPS aged care service, but also from the point of view of calculating your occupancy rate, i.e. how many people were actually utilising places in the MPS service during the financial year. Each of those time periods of service they came in and got access to services count towards that figure. We are required to provide that information to the aged care reporting team in the department, who are then required to provide it in statistics for the department's annual report, amongst other publications. Yeah. So let's move to the next form, the home care form. So this is about, and this collection of this information's really only been, this is the third year we're collecting it, and each year we've been collecting it. The quality of the information has been improving, which has been really good to see. So again, we have information about what the fields are and how they're defined, and obviously the same criteria around don't change the client's unique identifier applies. And then probably I'll just go to the form. The main difference here in terms of the compared to the residential services is we're asking information about how many occasions of service has that client received in terms of home care during the financial year. Okay, so really just gives us an idea of the frequency of service activity for that client. We're still learning about how home care works in the MPS, and that really contributes to that. The other thing here is obviously for someone who's receiving home care service, they may not have had an opportunity, or you've not had an opportunity to get to be with the client long enough to think that they have dementia. So really the question for dementia has changed to, has a client been diagnosed with dementia? Okay. So you know, based on the service plan for that client, that they definitely have dementia. Yep. Okay. And then it's all pretty similar. It's important to know that once you complete those reports and you're either attaching them to the annual activity report or they're coming in via email to us, we go through those reports and we do a quality check of them. It may very well be that we have to reach out to the MPS provider and or the individual MPS service and just ask some questions about the data if there's something that we either can't understand or that there are incomplete data fields in the report itself. Okay. But we're hoping that the instructions we provided to you and this webinar will minimize that activity. All right, I'm just going to pause here now to see if there are any questions about the demographics report.
Just quickly before we jump to Lee, there's two questions in the chat. One of them is from Laura Dent asking if the spreadsheet will be the same for next financial year, stating it will be easier if done at the time of respite, not in retrospect. And I've responded saying that it is almost identical to last year's spreadsheet, so they're welcome to continue adding to it.
Yep.
And then there was a second question from Catherine Ole. For home care clients, is this for all clients or only those who meet the criteria for aged care services?
Okay, so the point here is we're looking at the provision of these services under the Aged Care Act. So if you're delivering services to home care clients that aren't either eligible for MPS or CHSP or HCP, then I wouldn't be entering that information into the demographics report.
And Tony, there was a question also as well from Sharon Bursell. The client identifier has changed slightly at our MPS because we upgraded to the IPM system and are now linked in a wider region. Is it okay if we change the client identifiers?
Yep, that's fine. What I'd ask you to do is, if you've done that, can you put the old identifier in the comments column so that we're then able to link it back to the old record? And we have a couple of people with their hands up. Lee?
Oh, hi, good afternoon. I just have a question. Hello, sorry. I just have a question around the number of occasions of service and how, what's your definition of that? Because there's two ways that's captured, which you're probably aware of. One is hourly, and then the other one is per service for meals and transport. So how do we equate that into this report?
So we're really only interested in the number of services the clients received, not a measure of how many hours you've delivered. There's actually a question in the annual activity report that asks you to report the total number of hours of home care provision. So we capture it through there, but we currently don't require you to identify that at an individual client level. Does that help?
Maybe, because I know this has come up before, but I'll just, I'll wait until we get the material and have another.
Sure, have a look at it. I mean, it sort of really depends on, for example, if you're measuring it on an hourly basis, is a client only receiving an hour of service at that particular time, in which case you'd count it as one service, or is a service for 3 hours and therefore you count the 3 hours as one service? That's basically, we're trying to make it as easy as possible for you to measure it. The next question is Kathleen.
So if we have a patient that's in our acute beds and they're deemed nursing home type and we convert them to nursing home type, even though we don't have an aged care bed to put them into, like they're waiting a nursing home bed somewhere else, do they go on the spreadsheet?
Absolutely.
Right.
So it's really important for us to understand if your occupancy rate is above 100%, i.e. you're having to use acute beds in the hospital, that's really critical information to understand the demand for your services.
Yeah. Okay. Thank you.
Francis.
Thanks. Just a question on this home care client data. So I can see in this example that you've provided that you've got some rows where it says CHSP client, for instance, and then the date receiving home care. So am I to understand that for Humpty Do MPS, this report should include any clients? Because I guess I'm wondering that CHSP and the activity reporting is ordinarily separate to the MPS program, if you understand me. So there's the
I understand
MPS
you have
funding,
to do separate reporting.
And then there's CHSP. So for a client to be linked to Humpty Do MPS as a CHSP client would mean that maybe you're using that catchment area or something to identify them, because if they're not in an MPS acute bed and they haven't otherwise received an MPS home care service, how would you know to pick them up as being a relevant CHSP client to include?
Okay, so the important thing here is that in the home care space, MPS providers are able to utilise residential and or MPS home care funding to deliver home care services. We did a survey in February 2024 where we actually went out and asked the providers about how they utilise their MPS funding for home care. And what that came back to us says that in some cases, MPS providers are topping up the funding for CHSP clients or for HCP clients, or they're funding transport in order to deliver those services, or they're using the funding to pay for administration of home care, which then impacts the service provision. So if you're utilising your MPS client funding to support that client in that way, then we need to identify it.
Okay. So it's not all CHSP clients that might be happening in that area. It would be only where you've
only the ones where you've needed to use your MPS funding to support them. Yeah.
I see. I think it was a little confusing as well, because I understand you've got to bring in the revenue from CHSP, and then I was wondering if you wanted to see all the activity from CHSP as well allocated there. So but
it's very much about the focus on the MPS home care services, but understanding that we can't just simply segregate MPS funded home care. You got to look a bit broader than that.
Okay, all right, I understand the intent. Okay, great, thank you.
Cheers. Any other questions? Right, we'll move on in the last half hour to the annual activity report. I don't want to do that. No. Okay, I'm just going to bring this up here. I'll just ignore that. Okay, after you click the link in your email, you get taken to a web page, which is essentially what we call the annual activity report. The annual activity report uses an online web survey tool called Qualtrics. Okay, this is the best way to complete the annual activity report because it has built-in checks and also has built-in question jumps. If, for example, you say that we don't deliver home care, then what that would mean is you would miss all the questions around home care in the actual survey. So it's actually faster and more efficient for you to use the online survey form than it would be to complete it either through an Adobe Acrobat form or a Word version. So that's why we're really only providing this. If you really have troubles completing this form using Qualtrics via a web interface, please come back to us with a request and the reason why you need to access the other two types of forms. Okay, so the first thing here is at the top you'll have a survey completion. So this is a scale of how far you've progressed in the survey. It'll go through various parts in terms of the reporting period. It basically will tell you the year that it applies. The information for the site will be pre-completed because we're going to send out a link for each of your MPS services that you can utilize to complete that. That link, so you can send that link on to other people if you need to in your organization. Those people can go in and access the survey and complete their bit. And so what we're enabling is for different people in your organization to complete the various parts of the report. The most important thing though is just make sure that they don't go to the end of the survey and hit the submit button. As soon as you enter the submit button, the survey is completed. And if that happens and you need to come back and alter your entries, you'll need to contact us at the MPS agedcare@health.au inbox so we can reopen the survey for you. Okay, so the first thing is because that information is pre-completed, we're just asking you to check that they're correct. All right, so if I say no and go next, it'll then say, well, can you put in the correct data? All right, so I'll change that to yes. Okay, and we'll move on to the next question. So this is primarily about the referral process and the intake of clients. Firstly, we would just like you to identify the referral pathways for clients coming in to receive services for both home care services and for residential services. So we've got aged care assessment tool, family GPs, etc. The new integrated assessment tool that's been operating since December last year, etc. So this gives us a pretty good idea of how you're assessing the clients to determine what services they require. So I'm going to say we've been using the integrated assessment tool. It is multiple choice, so you can have more than one option if you'd like. And also there's another one where if you want to, you can say Humpty to clown assessment. Okay. You can put in other people or other assessments. Next, we're looking at fees and payments. The first question here is, does your MPS have a fees policy? Now, you think this is counterintuitive. Of course, all MPSs would have a policy for whether or not they charge client fees, but we are aware of at least one service that choose not to charge their client fees. Hence, we asked the question. Now, if you said no, what that would mean is you would skip all the questions around client fees, okay? But you need to provide a reason why you don't have a fees policy. So we're going to say yes, because the majority of you will have a fees policy. And then the way that you charge those fees for your clients. So you charge daily fees to all of your consumers some, or you don't charge daily client fees. And then we're asking you to put in the daily fee for the different types of services. So residential care, residential respite care, home care. Now, if you charge an hourly fee for home care, there's a box here for you to indicate the hourly fee. You will need to put in some number, okay? Because otherwise you won't be able to progress at this point. Okay.
Sorry.
And then we just
Sorry,
yes.
Tommy, to interrupt. Just a question in regards to the last question that you were at. Andrea Bonderson has asked if the rate changes over the year, how should they reflect that question?
I think you need to answer the question at the time that you complete the survey. All right, that's the best way of us doing it. So normally you would be, and when I say that, this would be the fee that you're charging at the end of the 24-25 financial year. So, because if this is about the 24-25 financial year, so whatever your fee was at the end of the 24-25 financial year, that's what you'll charge. If your fee then changed for the current financial year, 25-26, we don't want to know that. We want to know what it was at the end, towards the end of that financial year. I think Ashley's got a question.
Hi, Tony, and I might be jumping the gun a bit here, but in the attachment A comparison between old and new annual report, there's a question about when calculating the client contribution for clients in receipt of income support payments, which is labelled as C2, hasn't come up yet in the survey. Just wondering if that might have dropped off.
I'll have to have a look at it and get back to you.
That was removed by the assistant secretary.
Oh, yeah. Okay. Awesome. Thanks.
Okay. All good. We'll just have to update our documentation. Okay. So getting back to C4, in terms of the home care services, what's the most customary common practice you utilise, given that sometimes there's a bit of either your hourly, daily, or a bit of both. So if you can just describe which is the one you prefer to charge. And now we're looking at service provision. So much like previous years, this question aims to identify all the types of services, both health and aged care and community, that you deliver at the MPS service. Okay. It's important to note this gives us a complete picture of the way your service is integrated for both health and aged care. It is used quite often by the department, so we quite often get asked, does this MPS deliver these types of services? And this is the only way that we can respond to that question. Okay. Important to note here, when you're going down to the MPS funded home care services, if you deliver MPS funded home care services, you need to tick that box. If you don't tick that box, you will skip all the home care questions as well. Okay. And obviously, you're probably providing MPS residential funded services, and most of you are probably going to have acute care. Not all of you, but most of you have. So I'll just say that. If there's another service type that's different to what's on this list, please just tick, the type of service that you're undertaking. This is about identifying those clients. The next question is about identifying the clients with special needs. So important here, this information isn't identified in the demographics report. So it's the only way that we will know about those types of clients. So for that previous question about estimating the occasions of service, this is where you would answer the total number of home care hours of service delivered for the whole MPS service. Okay. But note that this is services that you provided funded by the MPS itself. So we're going to say we delivered 300 hours. If you have a subcontractor who delivers those services, you need to get that information from your subcontractor in order to answer the home care questions as well. And then when we go down to the type of home care services that you deliver, this is a list of all the services that you might currently provide. Okay. We do include home modifications as well. Yep. If you have another category, please list that category. And if you have a subcontractor who delivers those services to you, you tick yes, and then you'll have an opportunity to provide information on that subcontractor. If you have multiple subcontractors, you tick the box and you can just it'll keep duplicating that for you till you've got all your subcontractors. The next question is about the sort of challenges that you face delivering your MPS services. So we've got a list of categories here: balancing the provision of acute care and aged care in the MPS site, capital works, industry-related accident, infectious diseases, regulatory requirements, natural disasters, priorities identified by the community, suitability of the MPS site to deliver aged care services, workforce issues, others, or no difficulties. If you do have a difficulty, question D7 enables you to provide some contextual information about your responses. This should be multiple choice, so you'll be able to indicate more than one. Just waiting. Okay. Once you've completed your demographic sheet before, you can actually click here and it'll allow you to browse your IT system, whether that's your computer or your network, and you can upload that file here. What that means is that file is automatically attached to the annual activity report. It gets stored here in the department and we can pick up that file. So it's just it's a much easier way of sending us that information than emailing it. But it is up to you. If you have to email it because it has to go through certain clearance processes, that's fine too. So now we're talking about service demand. This is a specific question on waiting lists. So if you have a waiting list on any of your services, we just give you an opportunity to indicate the number of people on the waiting lists. And obviously you can have each of them. Or you can click the box which says you don't have anyone on the waiting list as well. For those people that have needed to leave the service, you can identify the reasons why they couldn't get access to the service, normally because they're on the waiting list, or because your service doesn't deliver the services they need. So you can indicate that here. This question here is very much about how many physical residential aged care beds you have at the service. Now, again, here it's important to identify those beds that you dedicated to aged care. If you have beds that are acute beds and you just happen to have an aged care client in them, please don't add them here, okay? Because this is a metric that we use to calculate your occupancy on a bed basis. So if you have clients in those acute beds, we would normally expect to see over 100% occupancy in those situations. So we might have 5 beds. And then there's a final question that gives you an opportunity to provide other comments regarding the MPS. And then finally, we have a question about how much time it's taken you to complete the different annual reports. We do this to get an indication of your respondent burden. So how much of a burden of time are you having to spend to complete the reports? That's really important to us. If you have a really high amount of time when you're doing it, we might come back later and talk to you about, is it a problem with the design of the reports, the process, or do you have other challenges that makes it really difficult for you to complete the report process? So I'm going to say I spent 5 hours and 15 hours on this. For the statement of income and expenditure, if you haven't completed, leave it at 0, but when you send it back to us, you can tell us then how much time you spent on it. All right, I'll have to fix that one. Yep. Again, if you completed your annual statement of income and expenditure before 31st of August, you can upload that there. And then finally, we go through to the button where we put in the details and the declaration. So I've declared that everything's correct. I put my name in. The date here is defaulted to the current date, but you can modify that if you want. Okay. And importantly here, you need to put in the email address that a copy of this report will be sent back to you. Okay. And then we sign it. Yep. Then we hit submit. All right. And that's completed our report. Okay. So I'll just, while I'm waiting for it to generate the PDF file, in the meantime, I think we can go to questions.
Hi, Tony. Both Catherine Ole and Ashley Levitt have asked if they can please have the survey in another format, such as Word or interactive PDF, noting that their final submission will be submitted through Qualtrics, but they use that to send out to the providers and have it returned to them. And the same for Southwest Hospital Health Service as well.
Yeah. Okay. So this is a situation where the provider has taken a decision to, in order to manage this process, they're going to send out the PDFs to the respective MPS services, and then they'll get that information back, and then they themselves will enter that information into the annual activity report. So we don't have an issue with that. What we really want to avoid is people having to send us the actual PDFs. And the reason for that is because the PDF is a flat structured report, it doesn't have the series of checks for data quality or the skipping functions that the Qualtrics report has. So it actually makes it a bit harder for us to both interpret the data, and it means that we generally have to spend more time going back to the provider. We're more than happy to provide that if you're willing to make that commitment to manage that at the provider level. Yeah. Okay. All right. Any other questions?
Vicky Jackson, I believe, has her hand up.
Okay, Vicky, yes.
I've allowed her mic, so she should be able to come through.
She looks like she's on mute still. Her mic is not working. All right. Do you want to type your question into chat, Vicky, or in the Q&A, and we'll try and get to it there.
Next is Kathleen Hillier.
All right, I'll go to Kathleen.
So Tony, if we have to send the report to somebody else to sign off on, how do we do that? And once you start the report, do you have to finish it straight away, or can you go out and come back in, or how does it work?
Sure. So the report's going to be open for a period of 3 months. So you can go in and out of the report at any time in that 3-month period. In terms of sending it to someone to sign off on it, if you send them a link to the report where you've completed the rest of the report, they should be able to go in and then complete the last bit, and that will effectively submit the report. Okay. So just by emailing them that link that we sent to you, anyone in your organisation can have access to the report.
Okay, thank you.
Not a problem. Yes, Vicky, she put a question in chat.
Not yet. I have tried disabling the mic and then enabling it again. Oh, here we go.
Oh, here we go.
Oh,
so
awesome.
easier, much easier than trying to type. So the question was sort of like Kathleen. So the same thing happened to me every year. So I've got 2 questions. So once I complete it all and attach the documents that I can, and then it needs to go to my delegate, which is my executive general manager for sign off.
Sure.
So previously I've inadvertently hit signed and submit, and then there's been a scramble to try and get it back. So you're telling me I can complete like up until that submit thing and just send the link, and then he can just sign it as the submitter?
Yep. And then he can press the submit button. Exactly.
Okay. And my other question was, it gets me again every year, is so in the selection, there's residential beds, there's wait lists for this, and home care. Where in our MPHS, we've got allied health team, community health team, an acute ward and all of that mixture, but the home care services or packages are actually provided by the CCP, or the CHISP or the old HAC, and that you said is going to be changing on the 1st. So I won't necessarily know if they've got any wait lists or what they're doing. So do I leave it blank? Or historically we've been given 10 home packages in 1886. And so, they're still, I guess, sitting on there. So I guess they've far exceeded those 10 packages out in the community. But that's how it all started with the HAC. So I get confused when I'm doing, we provide allied health services out. We do that stuff on community health, but we don't actually do a package, if that makes sense.
Sure, that makes perfect sense. Look, the important distinction here, Vicky, is are you utilising any form of MPS funds to support the provision of home care to this subcontractor provider?
Okay. Yeah, no, they're pretty much, Oh, well, are we? I need to check with finance if those 10 funded home care money is actually going to support that service, or is it coming back into our MPHS?
Yeah, so if you are using it, then you will need to contact the subcontractor provider who delivers the CHSP.
Okay.
And you need to inform them that you're going to have to report some information, very high level information, in the annual activity report. And also that we will need to identify those home care clients that they're delivering services to as well, if they're being funded through the MPS. In any way. So,
Well, again, that's the grey area. So, but thank you for clarifying that. I will try and follow that up and get an answer. Wish me luck.
Fantastic. All good. Ashley.
Hi again. Sorry, not a huge question or a major one. I just noticed in the annual activity report under Part B, the referral and intake, and I understand probably why you want to answer it from a site level with those questions, but that's also requested in the client demographic template at that individual de-identified data level. And I was just wondering, would that not be collated in that client demographic template? Not a biggie, just thought I'd mention it.
So I think it's important, I agree. It's important to understand that, and we understand that sometimes you're doing assessments for clients, and they don't always end up in your MPS service, okay? So we still need to understand the types of assessment services you're undertaking. Because certainly in the client demographics report, you're going to report on those clients who have been assessed and have become client, but sometimes that's not always the case. So we just need to link the two.
Yep, no worries. Thank you. And just want to say fabulous with improvements on the AAR, because you guys have streamlined it so much. So I really appreciate the work you guys have put into it. So thank you.
Okay, so we're nearly finished. Are there any final questions at all?
No additional questions that I can see.
No additional questions at this point. Okay. If you have questions but you just didn't have an opportunity to ask them, please email us at mpshcare@health.gov.au and we'll be happy to get back to you. Otherwise, thank you for coming along to today's webinar. It's been very interesting, and hopefully you've got enough information now to go forward and complete your reports. Again, I reiterate, they will be coming out via email either Thursday or Friday to you. So thank you for your time and have a great day, everyone. Cheers. Bye.